Good evening. I'm Dr. Gregory Abbas with Advanced ENT and Allergy, and we're here to talk tonight about some allergy and sinus relief. So tonight we're going to cover the root causes of inhalant allergies and sinusitis, allergy treatment options, non-surgical and surgical options for treating sinusitis, and reducing the risk factors for these. So what are inhalant allergies? Inhalant allergies are caused by things that we breathe in the air. They're tree pollens, outside we got weeds that pollinate, molds that send off spores that we breathe in. These are light and fluffy enough to be sent through the air at distances sometimes even 400 miles. And so you can be affected by something that's happening several hundred miles away as it's blown into your city. It also can be dander from animals, not the hair, but actually it's the skin. That's the dander. Dust mites, they're droppings, that's what we're allergic to, and it's not the actual insect itself. Okay, which takes us to the next line: is that allergic reaction begins when the immune system mistakes pollen or something we call an allergen, something that's in the air. It mistakes it as being foreign, and it mounts an immune response to that particular item. Now, this obviously could be several different items. Again, pollen, dirt, dust, dander, and dirt can contain anything. Any of all of those, what we consider dirt, can contain several different things: molds, dust mite, animal dander. All right. So then the immune system, what it does is it recognizes it as being foreign, and it releases histamine. And histamine is an inflammatory chemical that's produced by the body to protect itself. And so when the histamine is released into the tissues, that sends a signal to the immune system to send soldiers, basically, to go and fight an infection. So because the immune system thinks that this is actually an infection. All right? So basically, same thing happens with a virus. The immune system thinks that a virus, or recognizes the virus as being foreign, and mounts an immune response. An immune response of a virus is actually pretty similar to something as far as an allergen. So the reaction is very similar. Symptoms, the same slide here, or the next slide, the symptoms of allergies include sneezing, stuffy nose, runny nose. It could also include coughing, sore throat. And so all these are pretty similar to the symptoms that we have when we have a virus. Now, one of the differences between a virus and an allergic reaction is that the itchy, watery eyes do not tend to be present in a viral reaction, but are present during, or can be present in an allergic reaction. So that's one thing that can help distinguish between one and the other. So how do we reduce our risks for allergies? Well, first thing is to avoid exposure. Now, that's not the easiest thing to do. As we walk outside, we can't stop breathing the air. So unfortunately, when you're outside, you can't really do much about it. But you can do something about your exposure by altering the time of exposure. So the time of exposure is very important. So allergies like pollens and weeds tend to be present during the early morning hours and early afternoon. So if you have an allergic sensitivity to certain things in the spring or in the fall, you're best to do your activities probably in the late afternoon and evening, so that you have less exposure to the allergen during those morning and early afternoon hours. If you have animal allergies or dust mite allergies or mold allergies, those can be all year round. Those are more difficult to control, but you can control those in the house. There are ways to control those using cleaning techniques, filters, specialized filters in the house, and we'll talk about that a little later. Another way of easily reducing your allergen risk and the load, meaning the amount that you're being exposed to, is to flush your nose. Clean your nose out. It's kind of like brushing your teeth. You eat all day. You brush your teeth several times a day to clean your teeth and make them, clean off the bacteria from the teeth and some of the other sugars that attach and the starches that attach to the teeth. Well, same thing with your sinuses. In your nasal cavity is that there's mucus within the nasal cavity. The mucus collects pollens, collects all these allergens. And if you have a reaction to it, that mucus is going to keep it in place, and you're going to be more likely to have a reaction to it if that mucus is not flowing. All right? And so the easiest way to get rid of some of that mucus is to flush your nose with salt water. And so, salt water you can buy in kits at home or in kits at the store. And they're in every pharmacy, and there's several different types and as far as types of kits that you can use. I believe the bottles work really well. Most people think about the salt water as using a neti pot. The neti pot relies on gravity, and that works well. It relies on gravity to basically allow the flow of the water through your nose. And for some people that's more important because sometimes you can use one of these bottles too aggressively and spray too hard, and if you spray too hard and you don't allow the water to come out, it can actually go into your ears because the ear tubes sit right in the back of the nose and they go right into the middle ear. And so you can end up getting water going directly into the middle ear if you actually prevent the water from coming out your nose and you actually squeeze that bottle too hard. So again, technique is very important when using the bottles. But I think the bottles work better at actually loosening mucus and grime in your nose and getting that mucus out. Okay, that's something that can be done at least twice a day during the allergy season to help reduce the amount of allergen in your nose and reduce your inflammation inside the nose. And most importantly is that if you do have an allergy and you're outside all day, that you do this in the evening sometime before bed, because then it reduces that inflammatory reaction that's going to occur while you're sleeping. You're just having these allergen, the pollens or dust mites or whatever in your nose that could cause inflammation. Another way of reducing your symptoms of allergies is to reduce the inflammatory reaction that could occur when exposed to the allergen. And this is exactly what antihistamines do. So the antihistamines such as over-the-counter Claritin, Allegra, or Zyrtec, and their generic forms work really well. They're once-a-day dosing, and this is something that can be used to help reduce the inflammatory reaction. These antihistamines should be taken several weeks before the known allergy season. So if you know that you have springtime allergies, you should begin the antihistamine at least 2 or 3 weeks beforehand, because it's hard to know exactly when the weather's going to get warm, when things are going to start to pollinate. So it's better to have this on board so that you can prevent the inflammatory reaction from happening in the first place. That may not resolve or prevent all your symptoms, but it may reduce some of them, which is very important, because if you don't reduce some of them, then the inflammation within your nasal cavities and your sinuses will increase significantly and could lead to sinusitis. And one sinusitis can lead to another one, and then after several months of recurrent problems, this can become a chronic issue, which then may require more aggressive medical therapy and possibly surgical therapy. Okay. Ultimately, the ultimate treatment for allergy is actually allergy shots or immunotherapy. That's going to actually get directly to the source of the problem, which is the immune system, and treat the immune system directly. All the other medications and treatments actually just help reduce inflammation topically, so they make you feel better, but they don't solve the problem. So the only thing the only treatment option that has the potential to solve the problem is immunotherapy or allergy shot. And that can come in two different forms. One is an allergy shot, which we all heard of, where we get an injection typically once a week. But there are other acceptable options, including sublingual therapy, so drops under the tongue that do provide a similar effective treatment option for patients. What is sinusitis? Sinusitis is inflammation of the sinuses themselves. Now, when you look at healthy sinuses, we have 4 sinuses on each side. We have a frontal, a sphenoid, an ethmoid, and a maxillary sinus. The sinuses on each side are divided by a wall, and that wall is called the septum. Okay? Now, the nasal cavity consists of the septum, which is that wall, plus it consists of, they're called turbinates, or some people call them concha, but they are tissues in the nose that humidify the air as you breathe through your nose. And that's the main reason for those tissues, is actually to cause resistance to allow for humidification, but they also serve to filter. Now, there's a couple different reasons for the presence of those tissues. Now, much of nasal obstruction occurs because of allergy causing swelling of the turbinates. They don't typically cause sinus problems initially. So the sinuses become inflamed after a long period of recurrent exposure to something that causes inflammation, which could be a virus, a bacteria, and allergy. So what happens with the sinuses when they become inflamed is that the tissue swells up, and there are small openings in those sinuses that allow them to drain. When the tissue swells up enough and blocks those openings, the mucus gets stuck within the sinuses. And what happens with stagnant mucus? Well, bacteria love it. And so that's when you start developing a sinus infection. And that includes dull ache or pressure across the middle of the forehead, and also can extend down into the mid-face region. Frequent recurrent headaches, nasal obstruction, and you can have discolored mucus from your nose or from your throat. So most of the mucus tends to go down the back of your throat in general, and so that's when you're going to notice most of the mucus. But if you're blowing your nose and you notice discolored mucus, and you have these other symptoms, then it's very possible that you may have a sinusitis. It can also be allergy too. So allergies can cause clear or sometimes discolored nasal drainage. It just depends on how severe the immune response is. So how do we take care of sinusitis? Well, there's several options. Some are non-surgical and some are surgical. Preferably, we address them non-surgically with medications. Now, most of the time, sinusitis in a healthy individual will resolve within 7 to 10 days without the use of any antibiotics. Most sinusitis infections are viral in origin. All right, so a virus is not affected by an antibiotic. Typically, treating the symptoms will help reduce, I guess, the length of the sinusitis. And so the easiest thing to do is, if you're having those symptoms of congestion and drainage, is to reduce the congestion, to reduce the drainage, to get the mucus flowing. And those are the 3 most important things to do during an allergy and or viral infection to prevent the sinusitis. So allergy and sinus relief medication over the counter that contains a decongestant, and a mucus loosening medication such as Mucinex is very helpful. There are generics. I'm going to usually talk about the name brands because most people know the name brands, but the generic forms of them work just as well for most people. If a sinus infection lasts more than 7 to 10 days, it's not getting any better, then it's possible that an antibiotic may be necessary, and that's when you should come see one of us for treatment options. If another reason to look for further treatment options is that if you have some improvement of your symptoms and suddenly you get worse again. So your symptoms get better, and then all of a sudden you have a spike in your symptoms again. That's most likely representing a bacterial infection. And so at that point, you should get in and be seen so that we can actually diagnose it, culture it, and make sure that we're going to treat it properly with the correct antibiotics.